Good morning. My name is Harleen Kaur. So I'm here to present topic cancer along with my three group mates. They are Harleen Kaur, Navneet Kaur, and Urvashi Verma. So the learning objectives of the presentation would be to understand about cancer, recognizing its cues, analyzing cues, prioritizing its hypothesis, generating its solutions, and take actions and evaluating the outcomes. So, what is cancer? Cancer is an uncontrolled growth of abnormal cells. It can be due to genetic changes that allow it to divide uncontrollably. So, there are further various types of cancer that includes carcinomas, that's skin and organ cancer, that includes the examples of lung cancer, breast cancer, colon cancer, and sarcomas is another type that is cancer of connective tissues, and leukemia is a cancer of blood cells, and lymphomas is a cancer of immune system of cells. So next is the risk factors of cancer that include smoking, tobacco use, poor diet and lack of exercise, sedentary lifestyle, family history of genetic mutations, and exposure to carcinogen exposure of that, like something like exposure to the asbestos, chemicals, or ultraviolet radiations. Now, further, I will discuss about recognizing cues of cancer. So, firstly, we will discuss about the subjective cues, which includes the cues which are told by the patient or their family members. That includes the client will feel fatigue, pain, shortness of breath, nausea, weight loss, and decreased appetite. And certain changes in behavior can be seen, or mood can be seen, that is depression, anxiety, and difficulty in activity of daily living. So, further, there are some objective cues that includes vital signs. In this, there will be blood pressure of the client may be elevated or fluctuated, and that we can see tachycardia and tachypnea in the clients, that is excessive breathlessness to the client, and hyperthermia can be seen. There will be fever to the client, and there are some physical manifestations that include cachexia, that is unintentional weight loss, and muscle wasting is seen in the clients with cancer, and edema can be seen due to lymphatic or venous obstruction, and pallor or jaundice could indicate liver metastasis or anemia in the clients of cancer. So, in the objective cues, we will also discuss about the laboratory findings and diagnostic results. That includes CBC, that will indicate anemia, leukopenia, and thrombocytopenia. And liver function test will indicate enzymes that will be elevated, ALT and AST. And imaging examples, CT, MRI, and PET scans can indicate primary tumor and metastasis. And further medications can be recognized in the objective assessment, that includes chemotherapy agents. It can be because of this. So the use of doxorubicin can lead to bone marrow suppression, and pain medications such as opioids, which are used for the management of pain, are also an objective assessment of recognizing cues. And last is steroids to reduce inflammation. These are also are as a role in recognized cues of the cancer.
Good morning. I will be discussing about the next step, which is analyze cues. So, it involves reflecting on and synthesizing the recognized cues to identify patterns and connections. First is fatigue, pain, and weight loss, which indicates progression to the cancer, likely involving multiple systems like liver, bones, lungs. Then is anemia, contributing to fatigue, weakness, and tachypnea, which indicates pain or metastasis to the lungs. Then is pain, which is localized to bones or specific organs, which also indicates that metastasis has occurred. Next is elevated liver enzymes and jaundice. It indicates liver metastasis. Then is neutropenia or thrombocytopenia, which indicates risk of infection or bleeding tendencies. On analysis of the cues, we get to know what is concerning for the patients. The first is the cancer affects the patient's quality of life. The risk of infection due to low white blood cell count from chemotherapy alongside pain management challenges could severely affect the patient's quality of life. Then it affects the patient's systemic function. Fatigue and poor nutritional intake are indicators that the cancer may be affecting the patient's systemic function. Then is organ failure if not addressed earlier. So metastasis may be occurring, which could lead to organ failure if not addressed earlier. Next point is the cancer progression and treatment side effects like chemotherapy side effects, pain, anemia are having a profound impact on the patient's physical function and overall health. And lastly, depression is the other main issue that develops which requires the nursing specific procedures. Next step is prioritize hypothesis. In this step, we will prioritize the potential problems based on the urgency and the patient's needs. First is uncontrolled cancer growth and metastasis. This is a priority concern as the spread of cancer could lead to organ failure or death. Second is pain management, and effective pain control is essential to improve comfort and the patient's quality of life. Third is fatigue, which is likely caused by anemia, cancer progression, and poor nutrition, and this will need to be addressed to support physical activity and emotional well being. Fourth is infection risk. Due to chemotherapy induced neutropenia, infection is a major concern requiring stringent infection control measures. The last one is nutritional deficiency, which is due to poor appetite and cachexia. Addressing nutritional intake is crucial for maintaining strength and immune function.
Hi, so the next is prioritizing issues. Pain management. Pain can severely affect the patient's quality of life, so it is the highest priority. Infection prevention. Infection risk due to neutropenia and treatment side effects must be closely monitored and managed. Fatigue management. Addressing fatigue through anemia management and nutritional support is critical for maintaining energy levels. Nutritional support. Implementing a plan to address nutritional defects, including possible internal or parenteral nutrition should be prioritized to prevent further muscle wasting. Next is generating solutions. First is pain management. Administer prescribed opioids, like example morphine for pain control, and adjusting dosages as needed to maintain comfort. Consider adjuvant therapies like corticosteroids or nerve blockers for refractory pain. Non-pharmacological interventions such as relaxation techniques, acupuncture, or physical therapy may help complement pain management. Next is infection prevention. Implement neutropenic precautions, including strict hand hygiene, use of masks, avoiding large crowds or sick individuals. Monitor temperature regularly and assess for signs of infection, example fever, redness, swelling. Administer prophylactic antibiotics or antifungals if indicated. Next is again continuing with the fatigue management. Administer erythropoiesis stimulating agents, example epoetin alpha to stimulate red blood cell production if anemia is contributing to fatigue. Encourage rest periods but also advocate for gentle activity to improve circulation and reduce muscle wasting. Address psychological factors like depression, which can exacerbate fatigue through counseling or support groups. Next is nutritional needs. Consult with a dietitian to create a high calorie, high protein diet. If the patient is unable to eat adequately, consider internal nutrition or parenteral nutrition to meet caloric and nutritional needs. Monitor weight, serum albumin, and other nutritional markers regularly. Thank you.
Hello, Professor. I am Namneet. So I'm gonna present about the action. So in action, I'm gonna add that we have to administer prescribed medication such as pain medication and erythropoiesis stimulating agent, which will cure the cancer problem. And second, most important point is that we have to monitor vital signs. In vital signs, we will add like temperature, respiratory pulse to detect early signs of complications like infection or other problem. Third one is we have to implement infection control measures. So in infection control measures, we have to take step that we can cure and stop the spread of cancer. Fourth one is collaborate with the dietitian to develop and implement a nutrition plan. So in this, we have to add a multi nutrition and vitamin in the diet of the patient, because in the cancer stage, patient will feel weak by their and we patient will need a more nutrition and more vitamins need. So we will add in the diet. So patient will take nutritions and vitamins through their food process. So second, I'm gonna present about the evaluate outcomes. In evaluate outcome, the first point is that the final steps involve evaluating the effectiveness of the interventions, and we have to assess pain level regularly using a pain scale and adjust pain medication as necessary. Second is monitor the signs of infection, including changes in the temperature or new symptoms, for example, redness, swelling, that we have to evaluate every day.
Third one is evaluate fatigue and energy levels, on noting an improvement or worsening. Regular assess nutrition status, for example, weight and functional status, that the person's body function is moving, and ability and mobility as well. Ability to perform activities of our daily living, we will add in this regular assess. And the next one is expect outcomes like pain relief with the minimal side effects, prevention of infections through straightened precautions, and early interventions improve energy level and decrease fatigue. So this can stable nutrition status and preventing the further weight loss of muscle wasting. So these are all are added in evaluate outcomes. Thank you.